Hello, my name is Israel Jara. I'm from the Universidad Católica Santiago Guayaquil. Here's my social media. And I'll be talking about community-wide screening for tuberculosis in a high-prevalence setting. First, we have the introduction. What is tuberculosis? Tuberculosis, also known as TB, is a contagious infection caused by Mycobacterium tuberculosis. It was the leading cause of death in the 20th century. The tuberculosis infection can be latent or active, and that determines the effects. Symptoms include long-lasting cough, chest pain, night sweats, chills, fever, loss of appetite, weight loss. It can be determined through a tuberculin test applied on the skin or a blood test.
5 things to know about tuberculosis, or TB. 1. Anyone can get TB. TB bacteria are spread through the air when a person with TB disease coughs, speaks, or sings. 2. TB is not a disease of the past. CDC estimates up to 13 million people in the United States have latent TB infection. People with latent TB infection do not have symptoms and cannot spread TB bacteria to others. However, without treatment, 5 to 10% of people with latent TB infection will develop TB disease at some point in their lives. For some people, the risk is much higher. 3. TB can happen anywhere. TB cases are found in all 50 states. 4. Treating latent TB infection is effective and can prevent the development of TB disease. 5. It's important. If you are at high risk for TB infection, you should get tested and treated if you have it. Together, we can end TB in the United States. Learn more about tuberculosis by visiting www.
Now we have the epidemiology. Worldwide, tuberculosis is the leading cause of death from a single infectious disease agent and the leading cause of death among persons living with human immunodeficiency virus, HIV infection, accounting for approximately 40% of deaths in this population. The World Health Organization regions of Southeast Asia and Africa accounted for nearly 70% overall global TB. Although total case numbers were higher in Southeast Asia, overall incidence was similar in both regions.
Cool. Hi, I'm Emily here to talk about epidemiology for tuberculosis. Tuberculosis is a serious and deadly disease ranked only below HIV for top 10 causes of death worldwide. It is specifically dangerous for immunocompromised people such as those HIV positive. In 2017, WHO reported 10 million people globally to have contracted TB and 1.6 million died as a result of the disease. Global incidence of tuberculosis is falling by 2% each year. However, for many countries, including the Philippines, tuberculosis is still an epidemic threat. The Philippines is ranked 9th in the world for global burden of tuberculosis. In 2017, there was a total of 328,773 new cases reported and a total average incidence of 581,000. Tuberculosis-related mortality for the Philippines in 2017 was 0.36 per 100,000 population in HIV-positive people and 25 per 100,000 for those excluding HIV positive. That's 5.1% of their total deaths. In Australia, approximately 1,000 new cases are diagnosed each year, with most of these patients infected overseas.
Now the applications in medicine. The importance that community-wide screening has in medicine is that it reduces the rate of infection, it leads to early detection and leads to less deaths caused by this virus. It also enables to protect big communities that do not have direct access to medical centers.
More than 10 million people around the world have active tuberculosis, and every year more than 1 million people die from it, mostly in lower resource countries. Diagnosing TB in these settings is quite difficult. The historic standard of gathering a sputum sample and culturing it is slow and often not sensitive enough to correctly identify tuberculosis. And there are newer, sensitive methods that are very high quality, but they require equipment and infrastructure that just isn't available in many of the local communities where it's needed.
So we've created a fast multiplexed ultrasensitive TB diagnostic test that analyzes the levels of 4 proteins and an anti-TB antibody in blood to distinguish patients who have TB, active TB, from those who look like they have TB but have other respiratory diseases. Our test had very good accuracy and demonstrated an 86% sensitivity and a specificity of 69%, which is very close to the World Health Organization's target parameters of 90% sensitivity and specificity of 70% for an effective triage test. That is a test that can be used by local providers in local settings to determine which patients need to be taken to a clinic for further evaluation and definitive TB diagnosis. Now, our test also performed very well on patients and samples across 3 different continents, and that means that the TB test is effective in all types of TB strains. And it was also effective on HIV positive and HIV negative samples, and that's very important because in resource-poor settings, a lot of patients who get HIV also get TB.
The best part of our platform is that it can be configured into an easy-to-use point-of-care diagnostic test that costs only about $2, and it gives a result within 30 minutes. My lab at the Wyss Institute and the Brigham and Women's Hospital is continuing to work with Rushdie and Michael's team at the Broad Institute to refine and improve this test. And we hope that in the near future, it will be used to triage patients with active TB and get them the treatment they need, potentially saving millions of lives.
Pros and cons. Pros: long-term reduction in the prevalence of the virus, accelerate process towards tuberculosis elimination, keeps information updated annually, which allows for more control on the population. The tests are simple and people are more willful to take them. In 4 years, the results were admirable. If applied to a greater group, it could lead to even better results. Cons: some of the results of the expert MTV-RIF tests of the sputum samples are likely to be false positive or false negative. A number of issues require investigation before this community-wide active case-finding method is further implemented and scaled up to national tuberculosis control programs. In large scale, this could not be a great decision as it's not really convenient in terms of cost efficiency. People may not be open to the idea of testing themselves, especially those with not much education. There's other issues with more importance at the moment, such as COVID-19.
Tuberculosis may seem a thing of the past, but it's actually the world's top infectious killer today. Over 5,000 women, men and children still die each day from TB. Multi-drug resistant TB is also a top global health security threat. It is airborne and can affect any one of us. Yet, global actions and investments to end TB are falling far short of the targets set by the United Nations Sustainable Development Goals and the World Health Organization's End TB strategy. Among global health development efforts, investing to end TB is top value for money, with a return of over $40 on every dollar invested. To drive down TB deaths and suffering, we need intensified political commitment, multi-sectorial action, and more investments. This November, ministers and other global leaders from across the world will meet for WHO's Global Ministerial Conference on Ending TB in the Sustainable Development Era to commit to ramping up the fight against TB. This will be a landmark towards ending TB and will build momentum towards the first UN General Assembly high-level meeting on TB in 2018. Join us. Together, we will end TB.
In Ecuador, the country of the Americas have decreased the prevalence of tuberculosis by 61% between 1990 and 2012. And have reduced mortality from this disease by 68% in the same period. The progress achieved is due, in large part, to the implementation of the World Health Organization, the PAL, Stop Tuberculosis Strategy, which is based on timely diagnosis and treatment, universal treatment and appropriate combinations of anti-tuberculosis drugs. Ecuador presents a high percentage of underdiagnosis of childhood TB and a lower burden than expected, mainly in children under 5 years of age, mostly due to HIV. The use of common community-wide screening may be effective in the most vulnerable sectors of the country. Conclusion. In conclusion, in this investigation, it was found that annual community-wide screening for tuberculosis in an area in which tuberculosis is endemic was more effective than standard passive case detection alone in reducing the prevalence of tuberculosis in the population. While tuberculosis is in process of elimination, the best way to avoid tuberculosis is to prevent it through adequate measures.
My brother, my sweet little brother, please have your medicine.
No, I will not.
You don't want to be sick like Daddy, do you? If you become sick, you will also cough all night and get very weak. Do you want to become weak? No, right?
No.
Then take your medicine. See, I have also taken my medicine, and so have Mummy and Grandma. And it's very easy to take.
But I don't want to take it.
You are a good boy, aren't you?
Yes.
Then quickly take your medicine. Don't you remember what the doctor uncle said? He said that Daddy has TB, but there's nothing to worry. He's taking his medicine and he'll be okay very soon.
But I'm not sick.
Of course, you are not. And I hope my little brother never gets sick. That's why you must take your medicine. Doctor uncle said one more thing. Do you remember?
Yes. TB has come to our home.
Right. And what could happen if we don't take our medicines?
We might all get sick with TB, like Daddy.
That's right. So be a good boy. My strong, brave and good brother, please have your medicine.
All right.
Almost 1.7 billion of the world's population carry TB bacteria, but they do not appear sick. Out of these, 35% reside in the Southeast Asia region. Without treatment, about 1 in 10 of infected persons will develop TB disease at some time in their lives. Young children and household contacts of a TB patient and persons with weak immune systems are especially vulnerable. HIV positive, malnourished, cancer patients, those on dialysis. So don't take a chance. Don't just look to cure TB. Aim to prevent it. Remember, to end TB, prevent TB.